Everyone, welcome to an interview with Betsy and Jennifer. They're going to be joining us. They are both professional licensed mental health counselors. Hey, Jennifer.
Hi, how are you?
I'm doing good. How are you? I was just letting the audience know that Betsy is going to be joining us shortly, and just introducing you and what our goal is for today's talk. So everyone, this interview is really just to delve deep into trauma and massage therapy. For those of you that don't know, I'm a licensed massage therapist, the founder of Lumina Massage, and we are learning and growing when it comes to trauma. We have an excellent pool of mental health therapists, with Jennifer joining on board on our network. So we're pretty happy with that.
Thank you. Thank you for having me.
Yeah, not a problem. And yeah, so we're gonna have fun today. There she is. There's that beautiful face. That smile. Okay, great. So yeah, ladies, let's get started. Let's talk about trauma. I feel like we're like going into something exciting. Let's talk about trauma. Okay, so Jennifer, this is Betsy. Betsy, this is Jennifer. You are both professional mental health counselors, and you are both influential in how massage therapists, at least at Lumina, are going to, really just help the clientele and the patients that come in, and just educating us and helping us grow in this really, really important topic. And we want to be able to refer, and this interview is to help other massage therapists that have faced trauma and think to themselves, oh my gosh, what do I do with this? So Betsy, let's get started with you. In 1 minute or less, give us a brief professional credential and background on where you work and what you specialize in and how long you've been doing it.
Sure. Okay. So my name is Betsy Godoy-Rosado. I'm a licensed clinical social worker. I work at 4Kids of South Florida, soon to be 4Kids. And I am the manager of the EPIC services, which basically I manage the parent trainings. I manage trainings for the community for trauma. And I also teach them. I also train our therapists. I am a therapist myself. I have my own client like group as well, in addition to supervising other therapists. And so I have been doing this work now since 2012, so 10 years. And I specialize in trauma. I currently work with foster and adoptive kids, but I've also worked with people who have experienced domestic violence. And also I've worked with a variety of other populations associated with trauma and otherwise, federal population, many others. But for relation to trauma, that's my main focus. So, yeah.
Thank you so much. Jennifer, I'm going to loop you in here. You want to go ahead and introduce yourself and your practice name, and also same thing. How long have you been in practice, and what are like your 2 to 3 like not passion projects, but like, what do you like, what really fuels you in your work?
Yeah, well, thanks for having me, Michelle. My name's Jennifer Sotolongo. I'm a licensed mental health counselor here in the state of Florida. I am in Kendall, in Miami, and I'm the founder of One Stop Mama. That is my private practice where I specialize in working with mothers with anything ranging from perinatal mental health disorders, maternal mental health, and mother wound. Those are my, like what you would say, passion projects. Those are my specialties. We basically work on helping women manage motherhood, their emotions, their struggles, finding themselves after having children, And we even see some dads who are also struggling with parenting and that identity after bringing kids home.
Yeah. And for those of us listening, we are filming this on Friday, June 17th, and Father's Day is right around the corner. And I know that this is going to be like an evergreen thing on YouTube, but I think it's pretty cool that it's coming up, and we can talk all about how the culture is shifting for men, right? And their role in parenting. I think that's pretty interesting. So Miss Betsy, let's start with you. So recently, I did I feel like my first official 4-hour training with 4 kids, which was a trauma-informed training. It is not the full scope of what 4 kids offer, so I just want to offer a disclaimer. But I learned an incredible amount. I mean, I was taking notes like crazy. I have the notes in front of me, and I'm thinking to myself, massage therapists need to know these things. Like, it's a world. It's like a layer upon layer, and it's not cumbersome and it's not heavy. I mean, trauma is heavy, right? But it's so empowering as a massage therapist that we get to touch people's bodies, and we can also refer out to mental health practitioners, locally. And it's just, it's really, really nice. So Betsy, let's start with you, and let's go into what do you consider trauma care to be, and how would you, because you are experienced in receiving massage therapy. So for somebody that comes in and shows any signs of trauma and the massage therapist is working on them, what are some like key signs that you would see, maybe some nonverbal signs that a massage therapist would be like, okay, this might be trauma?
Absolutely. So the first thing you might notice is that they don't want to come in for a massage because they're going to be afraid of touch and they're not comfortable with it. They might not even know that they're afraid or uncomfortable with it, but that might be the first sign as a massage therapist. And you want to, in order to honor somebody who has experienced trauma, you might want to provide psychoeducation, but you definitely wouldn't want to force them. You might just want to say, hey, some people, and let's say you don't know their story at all, right? Because you probably won't. So you might say something to the extent of, some people who have experienced certain things in the past don't feel comfortable with touch, and touch makes them uncomfortable because touch has been harmful to them in the past. And sometimes working with somebody who practices healing touch, or touch that is respectful and that has boundaries and limits, can be good for that person to practice safe touch again, and then move into a place where they can feel comfortable with touch again. And we see this all the time with clients who have been sexually abused, for example. They're afraid to touch their babies. They're afraid to clean their babies the right way because they're afraid that they might do something wrong. And so they immediately connect that. And you know how important massage is for babies.
Yeah.
But these moms would be afraid to massage their babies because they'd be afraid of doing the wrong thing. And so that's really key. Other things, nonverbals that I might be looking for, assuming that they do end up in the massage room, they might want to take their clothes off fully. They might be uncomfortable when you touch particular places on their body. And some really good, you're going to pay attention to eye contact. You're going to pay attention to stiffness in their shoulders and stiffness in their body when you touch them. You want to pay attention to how they respond. And sometimes that could range from not being comfortable to say anything to you at all, like not telling you if it's too hard or too soft because they're afraid to say that, or even on the other end of the spectrum of they don't want any kind, like they're uncomfortable with a lot of the touch that's happening simply just because they're not used to safe touch anymore. So there's some examples of things that you could that you can pay attention for. And then I can talk more about what you can do to make them more comfortable when we get to the question.
Let me ask Jennifer. Jennifer, do you have any input on that same question? Non-verbal cues that a massage therapist would be like, oh, okay, maybe this is a trauma victim.
Yeah, I agree with everything that Betsy said. I think that the stiffness, the tension, the reservedness of this client would be the first thing that you guys would be able to pick up on. Because of course, if you don't know their story, there would be no actual, I mean, there might be some physical signs, right? But letting them paying attention to those actual nonverbal cues is tremendous for you as a massage therapist.
Okay, that's good. Do you ladies think it would be appropriate for a massage therapist to include a question about trauma in the intake form? Or do you think that would kind of turn somebody off and be like, what's going on?
No, you can just ask and say that you reserve the right not to answer. So you can say if you have any trauma in your history, and you might even want, if you have time, you might even want to define that very briefly. Like, have you ever experienced physical, sexual, or emotional abuse? And just that within itself, there's other types of trauma, but just to be brief, because obviously time is of the essence for all of us. I would definitely ask that question. I think that in itself is very trauma informed, just to ask the question, and they don't have to answer. They can say, you could tell me or not. It just helps me to know how I can best serve you. And there are other questions I would ask even as well, which is just, if, especially if they answer that, I would just, I would ask if it's okay to touch them. That question is so powerful, because obviously when you come to a massage room, you're expecting to be touched, but just giving that permission, just being able to say, hey, is it okay to touch you? Right. As soon as you come in, that consent, you're giving that consent to come in. And even, just for people who specifically struggle with trauma, I think it's great to say, hey, I'm going to touch your arms now. I'm going to touch your legs now. Or even because their eyes are usually closed, or maybe they can't see you because they're down on the table. So even just giving that little cue is going to be huge in helping them experience what it's like to control touch of their bodies, and what it's like to say, is it okay if I touch this? And say you reserve the right to say no if you don't want me to massage around your whatever. You know what I mean?
Yeah, that is an excellent example. I think a lot of therapists will benefit from that. So I want to share with you ladies a quick story about my own experience. So I remember one time I was, massage therapists are very touchy-feely, and some of them, not all of them, just assume that because this is their profession that everybody wants to be touched by them. So I'm in this gathering, kind of like a classroom setting, and it's for massage therapists. And this therapist just approaches me and places their hands on my shoulder without me giving any indication. I was so uncomfortable, and I could just feel the ego like protruding from them. And I thought to myself, oh my gosh, this is so inappropriate. Like, it is not okay. When we attend massage therapy school, we get massages every day. So like our barriers go down. Like, we see each other in very minimal clothing, and because the nature of our work. So we're like massaging each other and everything like that. So I think we lost Betsy. That's okay. Maybe she'll come back. But yeah, it was crazy, like how uncomfortable. And I was like, that is not okay. And that was a really, really long time ago. I think even before boundaries and mental health was like a staple in conversations. So, but Jennifer, bringing it to you, what are your thoughts?
I like how you brought in that ego, have that therapist having that ego kick in and feeling that because this was their profession, they were almost like entitled to touch.
Oh, entitled. Oh, I like that.
Yeah. So, kind of merging that in with what Betsy said about asking for permission and getting that client's consent for touch. That's so powerful because we don't know anybody's story. And when a client comes into your location for the first time, you don't know where this client has been or what they've experienced in the past, and giving them the opportunity to know that it's their choice where you touch and how you touch them is beyond beautiful.
Yeah, that's really powerful. Any other signs? So we went over lack of eye contact. We went over the resistance, maybe, some type of resistance with like, oh, let's remove. I think even telling someone how to take off their clothes. Some massage there, not all, I think that they've become really sensitive, but they're just like, okay, get naked. It's kind of like a running joke in the industry. It's like, okay, get naked and get on the table. And you're like, what's happening here?
Even I've seen a shift in the vocabulary that massage therapists use. I think a couple years back, a massage therapist would have felt that it was okay to say something like that, like, oh, strip down to, your undies and wait for me, naked while I step out. And now I think giving that client the option of, do you want to take off all your clothes? Do you want me to only focus on one area so you can maybe keep your pants on? I mean, giving them that option is just giving them so much power. For a person who's experienced trauma, that power, that choice, it makes such a huge difference.
Yeah, absolutely. And I think it's also very helpful for massage therapists to learn how to massage over clothing. People have this like, because of Hollywood and TV shows, like they have this stereotypical massage session. Like, okay, you're supposed to be quiet. There's supposed to be soft music playing in the background. You're supposed to not talk. I've heard of that. I've heard of even men being like, oh, I can't get a massage because I can't sit still. So I think it's really important in training for massage therapists to even feel more confident in being able to help. Some massage therapists get annoyed. They get irritated. What do you mean I can't touch your skin? How am I supposed to work? So, especially dealing with trauma, it would be wonderful for massage therapists today to just take an extra class or an extra training or just learn the skills of how to palpate that muscle tissue without necessarily taking the clothes off.
That would be extremely helpful. I mean, I can imagine for even clients that I see myself, what an opportunity it would be for them, how it would, bridge the gap of, I want to get a massage because I have either chronic pain or I just need a moment to relax, especially for moms. But because of their trauma, they don't feel comfortable maybe taking off their shirt or taking off their pants, and having a licensed massage therapist who knows how to give that clothed massage would make a world of a difference.
Yeah. Betsy, I see you shaking your head. Anything to add?
No, I'm agreeing with everything you guys are saying. I actually missed like a big portion of your story because I Zoom went off and like it kicked me out of the room and then brought me back. So I missed it, but it's okay. I'll come back and listen to it later.
Yeah.
Once you post the video.
It's all right. The gist of it was that this particular massage therapist, as Jennifer put it so well, just was really entitled and walked up to me and started massaging my shoulders, and just the energy I felt from their hands, I totally recoiled and they just kept going. And I felt really, honestly, I'm violated. That's the first word that comes to my mind. And I'm just like, I'm not okay with this, but I didn't speak up. And because I didn't want to be seen as like the prude in the room, or I don't know. I don't even know what foolish narrative I was believing, embarrassed in front of my colleagues. Who knows? But yeah, I remember that definitely happening. So Jennifer, I want to talk about moms specifically. When people think of motherhood, they still have this saint that has emerged, the woman that has emerged that can do no wrong, that never partied, never had a rebellious streak.
Born-
I'm sorry.
She was born the day that she had children, this mom.
Oh, okay. Yes.
Yeah.
She was born. You hear it a lot. So motherhood and trauma, typically when you hear of like a woman having a baby, you're like, oh my gosh, this is the best thing that could have happened to you. Like, can you share with us some examples of what you've seen women struggle with if they've been through either birth trauma or sexual abuse or physical domestic violence or anything like that? Of course, omitting any names, but can you just kind of share with us maybe a case that you've seen or an example?
Well, mothers come with their own luggage, right? They come into motherhood and they've lived their own lives for whatever portion that is before they have their children, and a number of things could have happened before they did have these children. I see everything from women who experienced emotional, sexual abuse, emotional neglect, where, I could jump into mother wound, and probably my favorite thing to work on with mothers in session. So I'll use that as an example. I have a lot of clients who come in and they're experiencing all these feelings, all these overwhelming emotions after they have children that might remind them of their own parent, their own mother, and they don't know what to do with it. They've tried very hard to be different from their mother because they don't want to be either emotionally abusive or emotionally neglecting. And they find themselves with postpartum anxiety, postpartum depression, postpartum rage. And so we dive into mother wound, which is, the impact of having a mother who was either emotionally or physically absent or even emotionally neglectful. These moms, we work on a range of things. They are struggling to manage the overwhelming tasks of being a mom and balance that with whatever it is their personal or professional lives bring to the table as well. And this is a form of trauma. I'm sure Betsy has seen this also. You have these moms who are coming in with their own children, they're struggling with their children, and then you kind of dig in and you find that this mom is struggling with things from her own childhood. So we kind of merge all those things. It's within mother wound and inner child therapy, and it's a beautiful world. Yeah.
Betsy, can you talk about that inner child therapy because you see a lot of kids, like your organization sees a lot of children. So I know that you do, I know that you see foster parents. So it's not birth per se, but that inner child work, I'm sure still has to come out. But what's been your experience with it?
So I see foster, adoptive, and bio parents because we also deal with kids who are returning to bio family, and also just from my own work that I've done over the years, because I didn't always work at 4Kids. But definitely with all adults, even people who don't have children, connecting to that inner child is very, very important. And what Jennifer is referring to, what we refer to is attachment style, right? So you have like your secure attachment and your disorganized attachments and your anxious avoidant attachments, and like there's 4 different styles of attachment. And so what comes out of this is maybe a child who's or person, an adult, whose mom didn't play with them, or whose dad didn't play with them, or who they experienced a lot of trauma in their childhood and they didn't really have time to play because they were too busy taking care of their younger siblings, right? Like they were trying to control the household and they were trying to take care of everybody because maybe mom or dad was a substance user and mom or dad needed support because the other one was absent, right? And so all of this, it could be many, many reasons, but the point is that they're not connected to that inner child and they're not connected to that playful person, that silly person that needs to come out. Play is extremely, extremely important. There are so many research studies that have been done about the association between play and intelligence, about the association between play and joy and like people and health and mental health. And so there's this concept of needing to be able to be silly as an adult, needing to be able to have fun as an adult, needing to be able to play as an adult, needing to be able to say as a mom, it's okay for me to want to go to a concert and leave my kids with a babysitter and not feeling guilty about that, right? And being able to do that. And I hope you guys are getting all of this because I know my internet is very spotty,
You're
but
fine.
hopefully everything that I'm saying is going through.
Hear
Okay,
you.
so it's this concept of being able to connect with that inner child. The most intelligent animal species play throughout their lifespan. And humans is one of those species, right? So it comes in, like, it makes sense, right? That there's an association with play and intelligence. And we learn through play. We learn social skills through play. We learn so many things through play. And so it's that connection. That's what it's all about. And yes, so many times I have to work with foster, adoptive, and bio parents on reconnecting with that person, reconnecting with that attachment, finding secure attachment, self-care, all of these things that help them reconnect with that inner child so that they can do that with their kids. Because imagine if you don't know how to play and then you're in front of a kid, how are you going to play with them?
That is true.
So that's what that's about.
Yeah, I have a question leading into attachment styles. So for massage therapists and people that do body work, I think massage is very unique in the sense that we are like hands-on touching a person for a full hour plus and more. So it's very, very unique. I mean, you have physicians that do palpation, you have chiropractors that also touch, but massage therapist is this really unique blend of just a very intimate service, right? What would you say to a massage therapist that is starting to say, like, to see the attachment, you know, that's not really well versed in attachment styles, but the client is just kind of showing signs that are a little off? Like what are some symptoms that you would see of an abnormal attachment to a massage therapist if the client were to see them maybe as a maternal figure or maybe as some type of comforting figure? Jennifer, you want to answer?
So I don't know if you'd be able to see that right in one or two sessions. It'd probably take a longer time, maybe like a returning client over, I'd say maybe a couple of weeks. What do you think, Betsy? Yeah, right. That's attachment styles are difficult to pick up on in what we would say is a traditional massage, right? Unless there's a lot of vocalizing and a lot of communication, you probably would not pick up on an attachment style. The only thing that comes to mind would be a client who's coming in very frequently and might become attached to the therapist for relief and cannot find any other type of relief between one massage and the other. That's probably a very big indicator of a client who'd have an unhealthy attachment, I would say, or an insecure attachment.
Right. So another thing that I would add to that, and a key here to understand, is that one of the most basic things of attachment is avoidance of eye contact and giving and receiving nurturing care. So you already know that somebody is working on their security of attachment if they're even willing to come to a massage, maybe unknowingly, right? Because no, most people don't go around trying to figure out what their attachment style is and how to correct it to become securely attached. But that's why, as a trauma-informed therapist, it's so important for me to know so that I can refer someone to massage, because if they're willing to receiving nurturing care is very hard for someone who has an insecure attachment style. And so just going to a massage within itself is huge, because you're willing to receive nurturing care. So that's one thing. Avoidance of eye contact is a big thing. And that's just another thing, because there's connection that occurs in eye contact. And obviously this is culturally dependent, because there are different cultures that that teach different things with regards to eye contact. And so we have to be respectful of that as well. But those are two things that you could pick up on. But definitely attachment is very complex. There are questionnaires that are hundreds of questions long just to determine attachment style. Yeah. And then there's shortened questionnaires. I've seen, there's a famous guy that he does YouTube videos that he actually does like a 6-question like attachment style thing. But he doesn't include disorganized attachment in it, because that's the least common attachment style. But he does include the other like 3 most common types.
Betsy.
Yeah.
All right.
So, and then secure attachment.
Yeah.
So,
that internet's not working in her favor. It's all right.
Resource for people to just figure it out for themselves. And even if they want to include that in their intake, those 6 questions can make a big difference in them understanding a person's attachment style. But I would say, if you're starting to see some of those signs that concern you, I would say to run to a health practitioner, because and a mental health practitioner who specifically knows about attachment, because not all of our mental health practitioners are well versed in attachment.
Okay, that's very good to know. Betsy, we lost you for a couple seconds there. It's fine. We're just going to work with what we have. Ladies, we're going to be wrapping up pretty soon, and this is for our viewers as well. I want to jump into fathers, because I did mention that in the beginning. So fathers and, kind of trauma with fathers, trauma with men wanting to take care of their bodies, maybe wanting to get massaged, but, what have you, and I'll direct this to Jennifer, what have you seen in terms of safe touch, nurturing touch, receiving care on a men's perspective or experience in your practice, Jennifer?
Michelle, I think that the younger fathers are more inclined to accepting that touch. But when I get a father who is possibly has like older children, right, like teens, for some reason that generation of fathers sees massage and touch as more of a feminine thing to do, right, like a feminine form of self-care. So they'll be a little bit
reserved.
Yeah, I was looking for the word. Reserved to getting that kind of service, no matter how badly they need it. It's a great form of self-care, and I think that allowing fathers to accept that touch, that would also open a world of expression, right? Giving them the ability to say, I need this, and I need to tend to this need. I have a number of fathers in the office who don't know how to receive or how to do self-care. They are afraid of being weak or being seen as weak and needing any type of assistance, whether it's even medical, not just massage, so medical, mental health. They're very reserved in saying, I need this help. So I'd be interested in seeing how a father would evolve after, let's say, a number of sessions with a massage therapist who's versed in mental health, right? And allowing them to use that time to nurture themselves.
Yeah. Well, I can say that I'm proud to say that Lumina has been at the forefront of two demographics that I feel are, well, not just two actually. Four, never mind. We're bringing in all the outliers, all the peoples. So we have a lot of guys that are literally dropped off at the entrance because the wife is like, I'm tired of hearing of your back pain. Here you go. But they say so lovingly. And the men respond so well. And, sexual services are something that unfortunately is tied to the massage industry. So, elephant in the room, but let's get it out there. And men have actually come in saying, I just want a massage, which is code for I don't want anything else. And they have responded so well to it because we follow up and we're like, how do you feel? And they're like, amazing. I feel amazing. So yeah, I really hope I think we are breaking through those barriers. The other outliers that we work with are pregnancy, which we're trying to break that fear in massage therapists, and pediatrics with children. There's not a lot of fear, but there's a lot of like unknown. But that could be in for another session. Betsy, we are going to close with you. Any final thoughts?
I would just say as a massage therapist, if you're trying to become trauma informed, look for trainings similar to the one that Michelle attended. And maybe I can also send you that link, Michelle, and you can include that because that's the only one I know of. But it's about becoming trauma informed so that your clients that have trauma, and by the way, a large percentage of the population has trauma. I think the most recent studies demonstrate that about 90% of the population has trauma. And so it's so important to help people feel safe in the therapy room. And I think you are going to have an advantage as a massage therapist if you are educated in that. And if you can bring that to your company, you're going to do your clients a great service. And it's going to be a great service to yourself ultimately, because I can tell when I come to a massage therapist that knows what trauma is and understands it and respects people, versus massage therapists who just don't know about it. And there's a huge difference in the service. And obviously, Michelle, I've been coming to you for as long as I have because I recognize that in you. And so I think that's huge. So that's what I would say. I would say educate yourself. And for you out there who's a massage therapist who's already trauma informed, slowly educate your clients and little by little bring that information to your clients, because you're going to help them. And we're creating the world that we want to see. And I think that's what we do when we help others, is that we help to be the change that we want to see in the world.
Absolutely. So ladies, I cannot thank you enough. Thank you so much. For our viewers, I'm going to be leaving links to Betsy and Jennifer and where they work, and including that trauma training. Please be encouraged. If you're a massage therapist and you're hearing this, get informed, get educated. There's a lot of people out there that need this service that can heal a lot from a traumatic past, utilizing a safe, compassionate touch with results. By the way, it doesn't have to be a feather light touch. You can still work out that tension. All right. Thank you so much, ladies. Have an excellent day, and we will catch you next time. Take care.
Bye. Thank you.
Thank you.